I'm Dr. Scott Fuller. I want to talk about laser, low-level laser therapy for low back pain in this segment. And I have a couple of cases here which are really interesting. So pay attention here. One is a woman and one's a man. This man is in his 40s, and this is a very typical lower back and leg pain case. I did the chiropractic thing, made a little bit of gain, but when I added laser, we really made a big change. And I'm going to show you a newer laser that I have now. So this one here, hopefully you can see it. I think you can see it on the screen there. And this is the same company where I have my other low-level laser, Erchonia, E-R-C-H-O-N-I-A, Erchonia. All it is light therapy. And the beauty of it is there's no downside, except for don't shine it in the eye. There's no downside. So it's such a nice tool. And I've been using lasers over 15 years now and seen magic. So listen to this case. A man comes in December 22nd of 2020. Low back pain, gradual onset a month earlier. It worsened over time. The past week it's now going down his left leg to the knee and calf. The pain varies from 1 to 10 on a 10 scale. So it can be really, really sharp pain. It's much less when he's lying and sitting. It's more when he's standing, bending, and working. He's tried stuff at home, biofreeze, over-the-counter medications, not much relief, although he does sleep well. So that's a nice thing in his situation. He does sleep well. Okay. He has a history of low back pain on the right side 10 years prior, took a couple weeks to resolve, and then he's had off and on minor problems since. That was the first visit. I was doing just chiropractic techniques on him for the first few visits. He comes in on December 23rd, low back pain, a little bit of relief that night of treatment. This morning it's a little bit better, and then as the day went on, it's right back to the 1 to 10 over 10, and it hurts in work. Okay? Then he comes in about a week later on the 28th of December. He said he was sitting more on a Friday. He had more low back pain after sitting. Over the weekend, it was up and down. He did some housework, and that flared up the lower back pain again. I'm sure that sounds familiar to a lot of you, right? I was a little bit better. Now the pain is fluctuating between 0 and 9 over 10, so not quite at the 10. Still doing chiropractic, not the laser yet. Then he came in on 12/30, December 30th. Low back was a little bit better for the day of treatment, the last visit, and then it's still 0 to 9. Okay. On January 2nd of 2021, he said his low back pain was a little bit better, and then we started doing the laser. So we started the laser on him and just shining it on his lower back. We did it for 5 minutes. So that was his first laser treatment. And I just want to show you the improvement that he noticed after we added the laser to the chiropractic care. So the next day he comes in, January 4th. Lower back pain, more sustained relief after the last visit for the weekend. The laser treatment seemed to work better, having longer stretches of time without bad pain. One laser treatment, this is pretty cool. Even in today in work was better. 2 days later on January 6th, this will be his third laser treatment. Low back pain, more sustained relief after 2 visits of laser. Less frequent sharp pain during the day. Still get pain on the leg, but not as bad. Still varying 0 to 9. So that would have been his third laser treatment. He comes in on January 11th. The lower back pain was more, but on Saturday and Sunday were much better, and Monday a better day. No sharper pain during the workday, only to 4 over 10. So after his 1, 2, 3 laser treatments, he went from 0 to 9 over 10 to a 4 over 10, and it just gets better from there. Okay, comes in on the 6th. He came in on January 11th. Lower back was more. That's when it went down to 4. Then he comes in on the 13th of January. Low back and left lateral pain to 4 over 5 on the 10 scale. Still much less sharp pain. It's about cut in half. Okay. So then we did 16 days after the first visit and 6 laser treatments. Today, on January 18th, he said, today is the best day yet. His lower back is 1 over 10 with no leg pain. That's awesome. And then he comes in on the 25th of January, and he said it gets no more than a 2. His overall improvements were 90%. 6 laser treatments is what we did, and it knocked that pain down. Now, I have to tell you, I cannot make any promises. These are exceptional cases just recently, but I wanted to share with you when we're doing some other things and it doesn't seem like working, I pull out the laser, and not for everyone, but really some magic things happen, magical things. So here's a 60-year-old woman. She actually calls me Magic Man with her lower back problems. She's had lower back problems for a long time. So March of last year in 2020, 2 weeks ago, she bent to pick something up, flared up the lower back, and actually hers is also left leg pain. Wakes her up at night. She can sleep a little bit if she takes Motrin and uses heat, but she needs to get up and walk around, and she has to use heat to get back to sleep. This might sound familiar to a lot of you. A year prior, she had a lower back episode, which we had resolved a few weeks in, and then 6 months ago after that, or 6 months prior to this, she had another flare-up after helping somebody move, right? So that sounds probably pretty familiar to most of you. So March 13th, after just chiropractic care, no laser yet, she slept a little bit better, then had a difficult night, sleeping a little bit better with the chiropractic care. She comes in on April 25th, so about a month later. She was doing great, but then she was reaching across the bed to reach for something. Boom, it set off the lower back and leg pain again. It was terrible. She couldn't sleep and so forth. Okay. She comes in on May 2nd of 2020. A little bit of relief, slept a little bit better, but still the lower back and leg pain is still a 6/10. So then I said, let's do the laser. She said, okay, let's go ahead and try that. So after 2 months of care, we started with the laser. She comes in 2 days later. Good relief after treatment for the last day. Less pain in the lower back the next day, and she could walk a little bit better. The pain was a 10/10 at times. Now it's 8/10. Second laser treatment, she said since using the laser, the pain is much less. She slept on her back the entire night, and you're familiar with this if you've had lower back problems. You're stuck in one position. You can't sleep in the position that you want to. She was able to do that. The pain was back down to a 3/10 in the back of the leg. After another laser treatment, the upper leg is fine. The lower leg is a little bit numb. The lower back is a 3/10. Now she's able to sleep through the night without taking the pain pills. Great gain on that as well. A couple of days later, pain is now 2/10, only a slight bit in the leg. The leg is getting stronger. Then we actually opened it up, and I do this in my office. I start opening up people. Well, let's work on some nutrition stuff. Poor nutrition is going to increase inflammation. If you increase inflammation, it's going to increase pain. Okay? So we start doing that. Then she said, I'm improving my diet. I'm not eating any sugar right now. I'm feeling good. Pain is 2/10. Then on May 29th of 2020, she said the lower back feels fine now. I don't need pills. I don't need ice. I'm able to be on my feet for hours. The numbness in the leg is almost gone, and I'm doing well. So she doesn't come in for 6 months. Last year in 2020, she doesn't come in for 6 months. She comes in back in November. She said the lower back and leg returned from working around the house, cleaning the house and so on and so forth. It flared up to a 7. Okay? We did the laser again. Next day she comes in. Pain is down to a 5. We did the laser again. She comes in 2 weeks later. Lower back is much better. It's now between a 0 and a 2. Later in December, much better. Then we had some snow here in New England. She said, I used the snowblower, flared up my pain to 7/10. That, again, might sound familiar to a lot of you. But after a week of care and laser, we knocked it down to a 3/10. She's doing well. Then she comes in January of 2021. Lower back was much better. Then she did laundry. I've talked about this on the show as well. Might sound familiar to her. It flared it up again, but we used the laser again. 2 days later, her pain is down to a 1/10, and the leg pain is gone. All of this with laser light. And remember, I've talked about this on prior shows. How does a laser work? A laser is like photosynthesis for a plant. A plant receives light from the sun and makes food. When we go outside, sunlight hits our skin, we produce vitamin D, we produce melanin for a tan, we have sleep and wake cycles in our brain sensitive to sunlight. Although lasers aren't going to produce vitamin D or give you a tan, the light laser adds energy to your cells, to the mitochondria, to the energy producing functions of the cells so cells can heal, reproduce, do their functions, whatever it is. That's how the laser works. Consider trying it. If you're not near the Boston area where I am, you can go to the website erchonia.com, E-R-C-H-O-N-I-A, erchonia.com, and there is a provider locator on that website. Good luck. Thank you.